podcast edition. This week, something a little different, something very, very special. We are interviewing somebody that has ulcerative colitis, diagnosed years ago, multiple medications, multiple biologics. Nothing was really working, only managing her symptoms. But with this unique approach on working on her spine, she was not only able to get rid of all of her symptoms, but get off of her medication. And we were able to do it by never meeting in person. She lives in a different state. Hear her story, see if it matches up to you, a loved one, your friends. People need to know this because so many people out there have GI issues that are getting mislabeled, misdiagnosed, and mistreated. Let's listen to Hadley and see what her experience was.
My name's Hadley, I'm 26. I was diagnosed in 2019 with ulcerative colitis for about a year, probably a little over a year before that. I had very severe stomach issues. Probably they gradually got more severe leading up to my diagnosis, but were overlooked by a lot of doctors before that. So I was having bowel movements like 10 to 12 times a day, blood in my stool, very intense stomach pain with eating. I was dropping weight very quickly just because I wasn't able to eat anything. So I weighed about probably like less than 100 pounds at 20 years old. That's very unhealthy. So I went to, after being overlooked by all the doctors where I'm from, I went to Mayo Clinic and they pretty much diagnosed me right away with ulcerative colitis, immediately put me on prednisone and some sort of biologic. And since then, that helped, more of like a Band-Aid situation, but helped temporarily. And since then, in the past 5 years, I'd failed 5 biologics or different medications and been on prednisone pretty consistently for the past 5 years. Haven't been able to come off of it for more than like a week or two. And now I am taking less medication than I ever have, and I'm off prednisone completely.
Nice. So when you had your first symptoms, was there any reason for your first symptoms? Did they just kind of come out of nowhere? Did they build up?
They definitely built up over time. I would say from a young age, I always had stomach problems, probably from like middle school on, which again was always kind of dismissed as like anxiety or, I was just, bloated or had a food sensitivity or something.
Yeah, what'd you do for those symptoms? I'm assuming you went to the doctor. I'm assuming you tried changing your diet around a little bit.
Yeah, so I tried pretty much everything. I mean, I went to a ton of doctors and, like I said, was pretty much overlooked because I was a young, otherwise healthy person.
List a few of the doctors that you went to. I mean, you went to your primary, right?
Yes, I went to my primary doctor. I went to a GI specialist. I had 2 full colonoscopies when I was younger than 16. I think at like 14 and 15 both. And they didn't see anything. I also went to more of like a holistic approach.
Like functional medicine?
Yeah. And she was actually the only one that actually like acknowledged that something was wrong, but she didn't know what it was.
Okay. Did she offer any explanation?
Not really. She had me get a ton of blood tests done and said that I was extremely inflamed, but that was about it.
So from 14 to 20, you're having these symptoms. You're going to the bathroom very, very frequently. You're having pain. You're having bloating. Mm-hmm. You're getting multiple tests done, but nobody's giving you any type of reason why. Nobody's finding anything. But then when you're 20, you went to the Mayo Clinic, and what did they find that led them to say, okay, you have ulcerative colitis?
My appointment, it takes a while to get into Mayo. So my appointment itself was like still a couple months away, but I was in such bad shape that my parents took me in through the emergency room and they basically admitted me right away. And I had a very low invasive scope done because I was so inflamed in my colon. They couldn't even get all the way up there to see, but just from being able to go in there a little bit and see that everything was so inflamed and see the ulcerations, they were pretty much like, this is what it is.
Okay, so they're seeing inflammation and they're seeing ulcerations.
Yeah.
And that led them to say, you have ulcerative colitis. Did they give you any other possibilities, or were they pretty sure?
Pretty sure. I mean, I think at that point, I was more happy to just have a diagnosis of something, and something they said that was, not curable, but manageable. And they just said, this is what it is. They ruled out Crohn's. So that was good, at least, because at the time they had told me that was way worse. And then they pretty much just started me on IV steroids immediately.
Okay, so they started you on steroids and then they started you on biologics, and you said that helped. But I know from working with you that you've been on, I think, a total of 5 different biologics. So obviously at a certain point, that treatment stopped working. What was their explanation for when you went back and it was working, but now it's not? What did they tell you?
They would either kind of categorize me as like a steroid dependent patient, and then if one wasn't working, they just kind of were like, okay, well, medicine's constantly advancing, so let's switch to this one, and here are the qualities of this one and why it might work better. But overall, all of the medications seem to be pretty similar. So
how so?
Just like they'd be like, oh, this one worked for you for a week, so we're going to try one that's similar to that and hope that it'll work for longer.
And you were on prednisone for the last 4 to 5 years, pretty much consistently, right?
Yeah.
And you're not supposed to be on prednisone that long.
Yeah.
No, you're not supposed to be on prednisone past a few weeks.
Yeah.
And you were on prednisone for a few years. Did your doctors say anything about that? Did they talk to you about, the dangers of that, or did they say that they're going to be able to get you off of prednisone?
They said they did always bring up the dangers, and they'd always be, I don't like that. Like, I don't like you being on this for this long. But obviously that's what was like keeping me, in a good state at that point. So obviously they always told me the risks of osteoporosis and how that'll affect my bone health moving forward. And I mean, I would go get, what are they? The
DEXA scans.
Yeah, like things like that. And I'd be the youngest person in there by like 80 years and they'll be like, what are you doing here? I'm like, well, I've been on prednisone my entire life. So just making sure my bone density is okay and all that. So.
Well, what would happen, because I know you would try to taper, what would happen when you would taper off the prednisone?
I'd usually flare at like 10 milligrams or lower.
What was your typical dosage then? What did you start with?
Start with 40 every time.
Okay, and then as you were tapering down to 10 milligrams, you'd start to flare.
Yeah, and so as I would taper down, sometimes the 40 like right away didn't even work, so I would have to go get like IV steroids to kick it off, then start at 40, and then taper down 5 milligrams a week. And then as soon as I got to like 10, around there, sometimes I get lucky and get to like 5, but then I would flare.
So injected steroids, oral steroids, biologics, and still having symptoms. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. How much would you say that treatment was managing your symptoms? If 0% is it's not helping at all, 100% is you're symptom free, what would you say you were sitting at if you were taking your steroids, if you were taking your biologics?
Probably 60%. I mean, I wasn't having the frequent bowel movements and I wasn't seeing any blood, but there was still a lot of underlying issues and symptoms that I would still have.
And what was their explanation for those symptoms, or what did they say that they would do to help manage the rest of your symptoms?
They usually just prescribed other medications, but I didn't really want to add more to my plate. So
this kind of brings us to when we met. So you're in Iowa, I'm in Pennsylvania. We haven't met in person.
Nope.
You found me on TikTok.
I did.
What made you think that, this person on TikTok would help you?
I saw a testimonial from another girl who had very similar symptoms. She was a lot younger than me, but she had a very similar symptoms to me. And it was a very, honestly, like moving testimonial of someone that had like a very similar like background. She was like a dancer in the past, and she had like back pain, and I think she had Crohn's, not ulcerative colitis, and she was pretty much symptom free and off of medication. And at that point, I was like inching towards getting surgery or getting parts of my colon removed or things like that. So I was like, last resort. I'd like had my eye on you for a while, but it was just kind of like, I don't know if I can do that with you being so far away. That just kind of always.
Sure. Well, you talk about the barriers, and one is the skepticism whether it's going to work, because I'm saying something that's completely different than anything that you've been told, and maybe you can talk to that during your journey, from 14 to, I think we met when you were 25. From 14 to 25, anybody that you went to for these symptoms, for your GI symptoms, did anybody say that it could have been your spine, it could be a back problem?
No, never.
Even a possibility, even mentioning it off the cuff?
No, I was going to say, truly, I was kind of thinking like, okay, if you can help with my ulcerative colitis, that's awesome. But I also had debilitating back pain too, that sort of appeared in the same time frame of having ulcerative colitis. And I was like, if you can just help that would be amazing. But we are far past that, so.
Well, so you have that barrier to entry, the skepticism, whether it'll work, me saying something completely different than the medical system is giving you, right? Mm-hmm. But then also the fact that you're a few states away from me, you're on a different time zone than me, and so this is physical therapy over telehealth, whether or not that'll work. So you had both of those kind of facing you. What made you take that final leap and say, all right, I'm going to give this a try?
I scheduled a meeting with the surgeon at Mayo, and I was like, I'm going to talk to him, but I'm not going to do that. I am not going to get surgery. So that was kind of my.
What did he say? What did the surgeon say they wanted to do?
Well, I canceled my meeting with him because I've been having good success with this. But scheduling that meeting really scared me. It was kind of like I was like accepting defeat, that I couldn't do anything about it. And I know that that's not true. So, yeah.
Well, then talk to me about our first visit. What were your thoughts after we met for an hour over telehealth. What were your thoughts after the first visit?
I was just really excited that somebody had hope. That I remember after the first call, you're like, I'm not even convinced that you have ulcerative colitis. And I was like, because nobody had ever, it's just been like my life for the past 5 years. I never thought that was even a possibility. But it was just very eye-opening and very encouraging.
How long until you saw any changes?
Probably within the first 2 appointments. with my back pain, at least.
I did pull up some of the notes here because I saw you at the beginning of June, and we're at the end of October right now. So we're sitting on about 5 months it's been, and I think we've had a total of 10 visits over that time. And on the first visit, you talked a lot about your back pain. You would sleep at night with a hot pack every night. You couldn't bend over to do the dishes or pick something up, and on the second visit, so a week later, you said, and you said your back was 77% better. You said that you were able to, still triggered by bending and letting the dog out, but dramatically improved. And then I think within another visit or two, you had stopped using the hot packs at night.
Mm-hmm.
The back was about 90% better within 2 visits.
Yeah.
And on your 3rd visit, you said that your bowel movements had changed. Specifically the urgency. The urgency had changed. Now you weren't rushing to the bathroom. And that's something that I see on a lot of patients, is one of the first signs for their GI symptoms is that all of a sudden their urgency, where most of the patients are seconds or maybe minutes, but a lot of times it's seconds when they get that urge, that now all of a sudden they can wait. They can wait minutes, 10 minutes, 20 minutes. They don't have to rush to the bathroom. And that was something that you were saying.
Yeah, for sure.
How long into the treatment until you were maybe convinced that this was going to help your GI symptoms, this was going to help your ulcerative colitis?
Probably by like our 3rd appointment, just because of like the way that it helped the urgency right away. I was like, all right, we're on to something. And I was still tapering down on my prednisone pretty well. And I'm sure it's in your notes. I don't remember where I was at that time.
30 milligrams, I think you were at.
So that was still pretty high up there. So I think it was like really, really crazy when I got to, on the 5 milligrams and like anything below 10. I think that was when I kind of like freaked out. But I mean, pretty much 3 appointments in, when things were like actually changing and like I hadn't really changed anything other than seeing you, that was very eye-opening.
What did your friends say when you told them that you're seeing somebody off of TikTok for your ulcerative colitis who is working on your back?
Yeah, every person I say does not understand at all how that works. They're just like, all right, that's cool.
If you had to tell somebody at home, if you had to describe this quickly, what would you tell them this is?
I would say, rather than like virtual physical therapy, it's like guided exercises with things that I can use at home, and they are pulling my spine away from my organs and helping my UC symptoms.
So where are you at now with your prednisone?
I've been off of it for almost 2 months.
In the 4 to 5 years that you've been on prednisone, have you been off it? What was the longest you were off it before this?
2 weeks.
And what happened during those 2 weeks?
Symptoms would just kind of gradually pick up, and then I'd flare.
And now you've been off it almost 2 months.
Yeah.
How are symptoms now?
Perfect. Amazing. They're basically, they're gone.
Any symptoms?
No.
Are you worried that it's going to flare back up?
No, I'm not. I kind of feel like the prednisone for me was always like a safety net. Like I would have it, and then when I got off of it, I would kind of fear that something would happen, and like I don't know if I was manifesting it happening or what, but now I feel like the exercises are more my safety net, that as long as I keep consistent with those, then I'll be okay.
And so maybe talk a little bit about the exercises too, because you're describing some exercises that are moving your spine. What did you go through during that time? Was it difficult? Did you have pain doing the exercises? Was it hard to keep up with?
I don't think they were hard to keep up with at all, just because I wanted to be healed so bad. And I was like, okay, if I have to, they take like 30 minutes in the morning and 30 minutes at night. And you're building up to that. So at first it's only like 1 or 2 exercises, and then you'll add a 3rd and a 4th and a 5th. And then now I'm at the point where we're kind of backtracking those things. But I was a little sore at first, just because, you're moving your spine around and it's not used to moving that way or stretching that way really. And I think since then I'm not really sore after doing them.
How do you feel when you do them now?
Really good, actually. They're like the best. Now it's just a part of my routine, and they're great stretches in the morning.
Do you think you'll have to do them for the rest of your life?
No, since I've already kind of started backing off on them, but I think for how long I've been on prednisone and how long I've been, diagnosed with this, probably at least for the next year or so.
Over this time, you talked about seeing multiple doctors, and we didn't really get into some of the things you tried on your own. Most of the time people try supplements, they try different dietary changes. I know you've had a very restricted diet. Have you started to get away from that at all?
So I've been gluten-free for 5 years, just personal preference of lessening inflammation. I don't really see that changing because I kind of like that guidance in some way. I feel like lessening inflammation on all fronts is great, but now I haven't really had to resort to like the brat diet or like things like that. Like anytime my stomach hurts or something where I have to eat like red rice, bananas, applesauce, things like that.
Before, you talked about eliminating gluten, but I'm sure you would still have some food that would trigger your symptoms.
Yeah.
Like what?
I didn't really eat dairy. Now I'm kind of dabbling more into that, or at least like high quality dairy at least. And especially like heavy cream or like really heavy dairy products. Those always upset my stomach really bad. I haven't really been seeing issues with that. And then also like raw vegetables, I've been able to inch my way into eating some of those, like more of like the cruciferous vegetables like broccoli and cauliflower and things like that.
How about alcohol?
That was pretty much a no for me for a while, and now I've been able to like inch into it a little bit. Like I can have a drink here and there, and there's no problem.
No effects from alcohol, from the vegetables, from the dairy? Okay. So we're seeing you're off medication for the first time in 5 years. You're off of it, and now for 2 months rather than 2 weeks. I know recently you went back to the doctor to have some testing, to have some blood work, to have some imaging done. What did it find?
They found it was not endoscopic remission yet, but I was in clinical remission, and then the biopsies that they took were very, very close to remission. So they thought that within the next couple months, I would be in remission.
Have you had imaging like that before?
Yes, a lot.
What did it show before?
A lot of active colitis. I'd been like close to remission before, but never off of prednisone. So the fact that when I had this done, I was over a month off of prednisone and still able to be almost in remission, it's a big deal.
I think we had talked before, and you said that this was pretty much the best your blood work and your endoscopy has looked. And that was over the last 5 years.
Yeah.
How do you explain that? How do you explain that it looks better, your blood tests are better, you're off of your medication?
Well, the only thing that I've changed, obviously, is seeing you. I mean, I don't really credit Mayo or any of the doctors for where I am right now, only because they just keep prescribing me things. But I am very thankful that they are open to letting me try different methods outside of what they do.
Have you talked to your doctors at all yet about what you've done, that's what caused the change?
Yes, I have.
And what did they say?
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
They are always, I have a really great doctor at Mayo, and he's really supportive, has always been, of all like the more like holistic methods that I want to try. And usually they have failed though. And, you know, it always resorts back to me being like, thanks for letting me try. I need help again, or I need steroids again, or something like that. But he thought that it was great. I mean, he said, just keep doing what you're doing, and you can just stay on the medication as well. So.
Did he have any questions about it?
I mean, I feel like I did a pretty good job describing it. It was more like, here's the exercises that I'm doing. Here's the goal. Here's what it's doing in my system, my spine, pulling it away from crushing my organs and stuff like that. So he just kind of asked what it was and what kind of exercises they were.
And so where are you at now, symptom-wise, during the day? So you're kind of your day-to-day, what do your symptoms look like now?
Now I have 1 to 3 bowel movements a day. They're all solid, no blood, no pain with eating, no bloating. I used to have really bad like gas pain underneath my ribs. I don't have that anymore. So just an overall more comfortable day to day, more normal.
Any back pain?
No, that's the best part.
And so maybe the $60,000 question, do you have ulcerative colitis?
I don't know. I mean, before this I would have been like, yeah, but I really don't know.
Yeah.
I'd like to think no.
If somebody out there, so when you were 14, you started getting symptoms. You started getting abdominal pain. You started having multiple bowel movements. If somebody out there is in the same boat, what would you tell them to do?
I would tell them, don't give up and don't settle for what the doctors around you are telling you. Because there's always, not always, but there is a way, there are other ways to do things than what the traditional medical system tells you to do.
Have you
come see you, obviously.
have you come across anybody else that says your spine can cause these symptoms?
No, never heard that.
How did you come across my page?
TikTok.
Were you looking something up specifically, or did I just pop up?
I was in a flare at the time, and I mean, TikTok is my favorite search platform because there's so many opinions, and it's very unfiltered opinions. And I came across your page and the testimonial video, and I sent it to my mom. I was like, I need to do this, and kind of obviously put it off because it's not cheap to do, but it's worth it. I mean, your health is all you have, so. Well,
and you've tried a lot of stuff. You've tried a lot of medications. It sounds like you've tried a lot of different doctors. How has this approach compared in treating your symptoms?
It's definitely way more, I mean, user friendly, I guess. Like, you can do it from anywhere, and you don't have to go, you know, to Mayo to go get an infusion, or you don't even have to really leave your house if you don't want to. It's very accessible, and it's not trying to get a new prescription for something, or, I mean, obviously it's questionable at first, like, is this going to work, is it not? But it kind of does take the guesswork out of, you know, everything, since you are very confident in everything you do.
Well, and I think kind of what you said too, you give it a few weeks, and then if it's working, great. If it's not working, then maybe you ruled out your spine.
Yeah.
And now you know that you have to go the medication, nutrition route. But for my money, if I have these symptoms and somebody's saying that there's a way, possibly without medication, without injections, without surgery, to not only treat the symptoms, but possibly the underlying cause that was misdiagnosed in the first place, I think everybody should at least be evaluated for it. And
I agree.
and like what you're saying, nobody even mentioned it to you, let alone evaluated you for it.
Mm-mm. And I've been going to chiropractors also like my entire life alongside of all the doctor's appointments, like weekly or twice weekly doctor's appointments for this also specific back pain, and nobody said anything, so.
Well, and you were still having back pain too, so that's kind of interesting. So what was the difference in their treatment versus mine? And because we took care of your back pain and we've never been in the same room together.
Yeah, I mean, it was a totally different approach than anything I've ever done. It was just like I feel like every exercise seems like it serves a purpose. And when you're at the chiropractor and they're just, cracking your back and things, it's kind of just like random, or they don't really like attach it to a purpose, But I even actually showed my chiropractor your videos explaining your method, being like, can you do this? Because I was already seeing her. And she was like, oh yeah, like that's super similar to what I usually do to you. And I was like, well, it's not doing the same thing. It's not doing what he says it's doing. So,
Well, and
obviously,
You've been through this now. How complicated was it?
not at all. I mean, it's mostly discipline of just doing the exercises and putting in the work, but it's very easy in comparison to, other things I've tried.
How many total exercises did you have?
Let's see, I had like 7 or 8.
And we're starting to back down, right?
Mm-hmm. So now I only do my initial 7 in the morning, and then I do 2 at night before bed.
Nice. And no recourse backing down.
Nope, not at all.
And yeah, so what do you think it looks like in the future for you?
In the future, hopefully to just stay in this very stable state. I like being not worried about flaring all the time because it's a big stressor taken off my plate, and hopefully just forgetting that symptoms ever existed and just starting new, moving forward.
Well, I hope to. Do you know when you have imaging scheduled for the future? Is it another 3 months or 6 months?
6 months. So
Okay.
It's going to be next March-ish.
Okay. I'd love to follow up, and I'm sure that it would help, this documentary or this interview, and if we could follow up and say, see where you're at, because we're hoping that you don't have any symptoms. And we thought that on this imaging, because you've only been really asymptomatic for about a month or so, that we thought that you were still going to have some inflammation, because it takes a while for everything to heal.
Yeah.
But we were pretty happy with what you saw, and you had your best test results that you've had in 5 years.
Yeah.
So we're hoping that in 6 months, you're not having any symptoms.
Exactly. So I think we're on the right track for that.
So Hadley, did you feel like ulcerative colitis was an accurate diagnosis for you?
Hard to say now. I mean, up until this year, I would have been like, yeah, textbook, that is exactly what it is. I have inflammations. I have ulcerations on my colon. But I think the deeper cause is saying that wasn't exactly what it was.
Well, and you had, in your words, debilitating back pain. Mm-hmm. And now you're realizing, like a lot of my patients do, that your back pain started around the same time that these symptoms started.
Yeah.
Did any of your doctors put that together? Did they put that connection together when you went to go see them?
No, I even went to a spine specialist at Mayo and had like an MRI done. I don't know if it was an ultrasound or something, because I thought I had like a tumor or something. I pretty much just wanted to rule it out, that I didn't have something crazy going on. And even after all that, no one said anything.
What did they say was wrong with your back?
They told me I had an extra vertebrae, and it wasn't connected to anything. So it was just kind of like shifting over.
Okay. Like an L6, did you have an extra lumbar vertebrae?
I think so.
Okay. What'd they say to do for it?
Nothing really. I mean, they said that there's nothing I could do about it. That was it.
Well,
They're like, oh, that just happens sometimes. And
What would you tell them now?
I'd be like, well, I tell them to look at your website. And so they can not tell people that there's nothing wrong with them when they have debilitating back pain, because clearly that's very discouraging and makes you feel like you're dumb for even asking about it.
Yeah, it's a shame that the medical system is the way it is. And that's, that's what I wrote my book about, and that there's a different approach for a lot of symptoms and conditions out there. It's a shame that you went almost 11 years with symptoms that weren't getting properly treated, assessed, or even diagnosed. And who knows if you had ulcerative colitis, or if you had also back pain, or if your spine caused all of these symptoms. But at the end of the day, the treatment that was applied to your spine was the most effective treatment that you've gone through. And for the first time in 5 years, you're off of your prednisone. You're not having symptoms, you're not having pain, you're not having gas and bloating and diarrhea and blood. And all of those symptoms were there with medication.
Yeah, exactly.
So I'm very happy, where you're at. I'm so glad that you were able to connect with me from Iowa, from states away. I'm happy you were able to find me over TikTok. Hopefully, somebody else out there, just like you saw that young girl's testimonial, somebody else out there sees this and says, hey, that's me. I've had this, and we start getting this information out there.
Mm-hmm. I hope so too.
Yeah. Thank you, Hadley, for doing this. It was, I know it's difficult to talk about some of these symptoms. So very brave of you to do this, and have this out there. But I really think it can help a lot of people if we could cause some change in the medical system.
I agree. More people need to hear about this.